River Orthopedics started in the fall of 2020 to bring a service line to the healthcare system that wasn't previously available within the healthcare systems.
Orthopedic conditions can be very debilitating, and when you have people come in and they've been in pain for several years, they can't walk or just have weakness, and then coming back 6 weeks later and having no pain anymore, that's really a great feeling.
It's a family-oriented type practice. We're relaxed yet professional, and we always make a patient the big deal because surgery is a big deal.
I think our approach to patient care is such that we truly want to know and understand our patients, both them as people as well as the problems that they're dealing with. Because I think that when we have a more comprehensive understanding of the patient, that helps us to provide a more specific solution to their problem.
My husband and I traveled a lot. We were on the road full time as RVers. We were in the middle of nowhere, Texas, literally. I said, let's stop at the grocery store and I'll get some cocoa and make a chocolate pie. And that's where the accident happened. I shattered my hip. I was in the hospital for 2 weeks, small hospital. A year later, I couldn't tie my shoe. I couldn't put my shoes on. I couldn't ride a bicycle anymore. I couldn't kayak anymore. I wasn't fun anymore. I did photography, just a novice, but I would scale 30, 40-foot embankments to get down under a covered bridge and take pictures of that. And I couldn't do that anymore. My husband said, this is going on long enough. You're going to see a doctor that knows what he's doing. We called Dr. Meyers' office the next day. They had me in within a week. Within 2 weeks, he scheduled surgery. A year later, we were out and adventuring again. We went to Alaska for 6 weeks. I could walk again. I could ride a bike again. I can pick up my great-granddaughter now and be with her. So I get emotional because he brought me back.
The feeling as a team that we experience when patients do that well and have that kind of a life turnaround, you can't even put into words.
And if we can keep people active and keep them moving and get them out of wheelchairs and get them walking without help or assistance, it's just such a great benefit to not only their mind, but just their overall health.
We treat every patient as if they're our family member, brother, sister, aunt, uncle, and we give advice based upon that, or if it's a child, as if it was one of ours. If we make all of our decisions based upon the fact that they're a family member, I mean, how can you go wrong?
In the hospital, we knew everybody by first names. There's not enough you can say. We are family.
When we talk about treating people like family, I think anybody that either works with us or maybe has been treated by us would say that we've probably used those exact words. We are an evolving orthopedic practice, and we try to adapt those new technologies, new procedures, new techniques in a very meaningful way to benefit the patients of the Mississippi Gulf Coast.